Good morning. I would like to thank Professor Schiza and Professor Adoniou for this invitation to discuss the vaccination strategies in primary care. As we all know, vaccination measure is a very important measure in public health. Implementing vaccination programs in primary care faces a multitude of challenges, ranging from logistical issues to social and cultural barriers. First of all, I will talk about the operational barriers. First, the workforce shortages. Worldwide, we know that the numbers of family physicians are decreased. A shortage of trained healthcare professionals, coupled with burnout and high turnover rates, affects the capacity to administer vaccines and educate the public effectively. Data management issues. Inaccurate or incomplete data collections. We can't have the identifications in daily clinical practice of unvaccinated individuals. We can't find them. It's very difficult using the electronic system in Greece in our days to see who from our patients is not vaccinated. Other funding. Insufficient funding for immunization programs leads to resource shortages. There are many studies that they say that with no motivation, we have no vaccination. And political interference. Here in Greece, nowadays, our government is has the will to make programs of prolepsis, and the vaccination is one of them. Our country has many disparities. We have islands, rural and isolated areas that these areas experience low vaccination coverage. And these are the operational barriers. But we have communications challenges, misinformation. We lived during the COVID pandemic, the spread of false information through various media channels and can undermine public confidence in vaccines. All of us, the healthcare professionals, we are not training in communicating interviews. We don't know to communicate the benefits and the safety of vaccines. And this is leading to missed opportunities to address patients' concerns. The vaccine hesitancy, misinformation, cultural beliefs, and religious misconceptions contribute to reluctance or refusal to vaccinate. Gender and social norms. In some communities, the decision-making power lies with male family members. And community trust. Distrust in healthcare systems and authorities can impede the acceptance of vaccination programs. Addressing these challenges and multifaceted approach, including strengthening healthcare infrastructure, improving funding mechanisms, enhancing communication strategies, and fostering community engagement to build trust in vaccination programs. Let's see the strategies. Reminder and recall systems. Implementing automated systems through electronic health records can significantly improve vaccine uptake. Studies have shown that such systems can increase immunization rates up to 10%. We can use technology for reminders and education like SMS, email, application-based systems, reminders to notify patients of upcoming vaccinations. And of course, we have to do digital health literacy tools, develop and disseminate user-friendly digital resources. Strong, clear, and empathetic recommendation from healthcare providers is one of the most effective ways to encourage vaccination. Tailoring the message to the patient's specific health context and addressing concerns directly can enhance vaccine acceptance. Integrated and flexible services. We have to offering vaccinations during routine visits, extending clinic hours. We all know that if we are working in the public sector, we have 8 to 3, but there is a need to extend our hours in order to have increased vaccination rates. Enhancing access and convenience. Extend clinic hours, as I said before, and we can use mobile vaccination units. Before 3 months, we have a program that we do it with AOD and mobile units of AOD. And we can use these mobile units for underserved and rural populations for vaccination programs. Education and training. Regular training for healthcare providers, for all the healthcare personnel. They have to inform about current immunization schedules and can confidently address patients' concerns. We have to equip healthcare professionals with skills to engage in empathetic and informative discussions about vaccines, addressing concerns and dispelling myths. Strong, clear, and empathetic recommendations from healthcare providers are among the most effective ways to encourage vaccination. And we have to do programs for diverse populations, for children and adolescents, utilizing school-based clinics, adults and elderly, implementing standing orders, and can ensure that adult vaccination needs are assessed during every clinical encounter. Rural and underserved communities, deploying mobile vaccination units and conducting door-to-door campaigns can overcome barriers related to access and transportation. This will be the new role of the mobile units. And we have an example, low vaccination coverage of Greek Roma children. There was a published data from Thessaly, but a later study has shown that the role of local primary health care units in increasing immunization uptake among children in vulnerable social groups through vaccination campaigns. They use campaigns and they use a Roma mediator to deliver a campaign involving a house-to-house visit, in-person communication by trusted community workers, on-site vaccinations, and child development follow-ups. The result of this schedule was to have increased vaccines to all the children, to 300, 400 children under a year in the Roma population. This is a good approach of this population, and we have to know what vaccines we need to do, and we have to do these vaccines. Yet if we are not vaccinated, we are not protected. This is the 3 stages of life, and thank you very much